Hello and welcome to True Pathfinder, your portal to health and truth. And in this video we're going to look at neuromuscular disorders such as muscular atrophy, MS, GBS, Parkinson's and ALS, amongst others. So let's discuss the symptoms, the diagnosis methods, the possible causes and natural solutions to take care of these conditions. In TCM, these neuromuscular disorders are known as weisyndrome, which means a limb motor impairment caused by muscular atrophy. Weisyndrome is characterized by muscular flaccidity, liability, or atrophy of the extremities with motor impairment or even paralysis at a later stage. And it manifests in many diseases such as muscular atrophy, dystrophies, myotonic syndromes, periodic paralysis, myasthenia gravis, endocrine myopathies, and hysterical paralysis. And Way syndromes are caused by the following factors. Number one, malnourishment of the channels and tendons caused by an exhaustion of body fluids due to an invasion of exogenous pathogenic factors, and also wind heat to the lung organs. The lung is the organ that faces all channels and collaterals and keeps the average circulation of Qi and blood. It can also be caused by obstruction and lesion of the channels and tendons due to accumulation of damp heat caused by living in wet areas, eating fat, hot and spicy food, and or drinking too much alcohol. Malnutrition of the channels and tendons due to the Qi and blood deficiency caused by the spleen and stomach dysfunction is another possible cause. And malnutrition of the channels and tendons caused by an insufficiency of the liver and kidney essence, as well as Qi in the later stage of chronic diseases or after excessive sexual activities, is yet another one. Western medicine postulates that, quote, neuromuscular disorders affect the nerves that control voluntary muscles and the nerves that communicate sensory information back to the brain. Nerve cells, so the neurons, send and receive electrical messages to and from the body to help control voluntary muscles. When the neurons become unhealthy or die, communication between the nervous system and muscles breaks down, and as a result, muscles weaken and waste away, which is known as atrophy. These disorders result in muscle weakness and fatigue that progresses over time. Some neuromuscular disorders have symptoms that begin in infancy, while others may appear in childhood or adulthood. The symptoms will depend on the type of neuromuscular disorder and the affected areas of the body. Some symptoms that are common to neuromuscular disorders are muscle weakness that can lead to twitching, cramps, aches and pains, muscle loss, mobility impairment, balance problems, numbness, tingling or painful sensations, droopy eyelids, double vision, troubles swallowing, and troubles breathing. Some of the most common neuromuscular disorders are amyotrophic lateral sclerosis, also known as ALS, Charcot-Marie Tooth disease, multiple sclerosis, muscular dystrophy, myasthenia gravis, myopathy, myositis, including polymyositis and dermatomyositis, peripheral neuropathy, and spinal muscular atrophy. How can we diagnose these conditions? Well, the patient's reflexes and muscle strengths are checked, as well as other symptoms. And this leads then the physician to order additional diagnostic tests, including a blood test to check for elevated enzyme levels. Also magnetic resonance imaging, so MRI scans of the brain and the spinal cord. Lumbar puncture may also be advised, also known as a spinal tap, to check the cerebrospinal fluid, as well as electromyography to record the electrical activity of each muscle. Nerve conduction studies to see how well the signals travel from the nerve to a power, and muscle biopsies also to examine a sample of muscle tissue under a microscope. And last but not least, genetic testing to confirm gene mutations. By the way, all of these conditions are considered to be non-treatable in Western medicine. But as we will see in the course of this presentation, in our opinion, this is not true, because there are some natural solutions that can help you. Let's discuss next the different types of muscles. But before we do that, short reminder, if you enjoy our content, please support us directly by becoming a patron from as little as $5 per month. Link is in the description box below for you. Also, do not forget to like, share, subscribe if you're not already, and comment to help this channel grow and spread the truth. For the holistic, customized treatments you need and deserve, please contact us at christine.doctor and check out some of the most powerful holistic health tools available on the market today at vibrantbody.net. Alright then, first we are going to look at the so-called smooth muscles. They originate from the intestinal muscles of the primordial oropharynx intestinal rectal canal. The smooth muscles of the intestines, sigmoid colon, the upper part of the rectum, the internal rectal sphincter, the renal pelvis, ureters, bladder, urethra, internal bladder sphincter, esophagus, bronchi, larynx, uterus, myocardium, the blood vessels, including the coronary arteries, the veins, the aorta, the carotid arteries, as well as the subclavian arteries, the lymph vessels, the pupils, and the ciliary muscles. They all originate from the endoderm. Smooth muscles are involuntary, non-striated muscles. Their ability to contract allows moving the food muscle, or the blood muscle, or the air muscle, as well as the urine muscle and the semen muscle and the light muscle through specific organs by peristaltic motion. And the smooth muscles are controlled by your midbrain, which is located at the outermost part of the brainstem. Note that the male and female germ cells are also controlled from your midbrain. In a biological conflict, the related muscles generate cell proliferation during the conflict active phase with increased muscle mass and local muscle tension. And in the healing phase, the muscles may first show spasms and then relax. Then we have the so-called striated muscles, which developed when more efficient muscle functions were required. The striated muscles are skeletal muscles, the myocardium, so the ventricles, the coronary arteries, the veins, the aorta, carotid arteries, subclavian arteries, blood vessels, the tongue, the jaw, the ear, the bronchi, the larynx, diaphragm, esophagus, the slight curvature of the stomach, the pylorus, the duodenal bulb, pancreatic ducts, bile ducts, gallbladder, cervix, cervical sphincter, vagina, rectum, external rectal. By the way, the new mesoderm controls the sphincter, renal pelvis, ureters, urethra, bladder, external bladder sphincter, eyelid muscles, the ciliary muscles, as well as dextroocular muscles. The cerebromedulla controls the trophic function of the striated muscles, and the motoric function controls the muscle's ability, and this relay is in the so-called motoric cortex. In an active biological conflict, the related muscles generate cell loss and muscle paralysis, and in the healing phase, the muscles are reconstructed. Muscle cramps, rhythmic convulsions, spasms, or muscle twitching may occur during this healing stage. From an evolutionary point of view, tonic-clonic contractions during childbirth became the blueprint for the striated muscles. Tonic-clonic seizures involve tonic, so stiffening, and clonic, so twitching or jerking phases of muscle activity. Tonic-clonic seizures may start with a simple partial seizure or aura, and then the person may experience sensation, mood, or emotion changes leading up to the tonic-clonic bout. What are the functions of our skeletal muscles? Well, the musculoskeletal system provides a form to the body and also allows it to move and maintain its posture. The muscles are connected to your bones and joints through tendons and ligaments and are endowed with connective tissue, nerves, as well as blood vessels. The skeletal muscles are composed of bundles of fibers that are organized in a striped pattern, and therefore they are called striated muscles. Skeletal muscles vary considerably in their shape and size. They range from highly tiny strands, such as the middle ears, the pedius muscle, to large masses like your thighs muscle. The skeletal muscles have two control centers in your cerebrum. The trophic function, responsible for the nutrition of the tissue, is controlled by the cerebral medulla. The contraction of the muscles is governed by the motor cortex, and the muscles of the right side of the body are controlled from the left side of the cerebrum, and the right cerebral hemisphere governs your left side. Hence, there is a crossover correlation from the brain to the organ. In the cerebral medulla, the bones, skeletal muscles, lymph vessels with lymph nodes, the blood vessels, the connective tissue, and fat tissue, they all share the same brain relays and biological conflict or stressor, namely a self-devaluation conflict. And the control centers are orderly positioned from head to toe. So, the biological conflict linked to your skeletal muscles is a moderate self-devaluation conflict. The specific self-devaluation conflicts are the same as for the bones and joints, and in line with evolutionary reasoning, self-devaluation conflicts are the primary conflict associated with the cerebral medulla controlled organs that derive from the new mesoderm. The biological conflict or stressor related to the movement of the muscles is a motor conflict where you feel that you're not able to move or you feel stuck. This type of conflict can be associated with your entire body in a generalized motor conflict or just a single muscle or muscle group in a localized motor conflict. The underlying biological conflict is different based on the significant function of that part of the body. For example, if you have problems with your facial muscles, the conflict here is one of losing face, a loss of status, reputation, respect, honor, prestige, or dignity, disgrace, humiliation, shame, being exposed, feeling ridiculed, foolish, or stupid. Jaw muscle problems stem from not being able to bite. Neck muscle problems from not being able or allowed to move or turn the head. Shoulder and back muscle problems from not being able to get out of the way or step aside. Problems with your arm muscles stem from being forcefully held down, for example, by physical abuse, sexual abuse, during a vaccination or in a fight or play. Also not being able to hold or embrace someone or hold someone back, not being able to push someone away, fight somebody off, or defend yourself. For the hand muscles, the underlying conflict is not being able to hold on to someone or hold someone back. For example, a loved one who is leaving or dying, not being able to grab something, and any distress associated with their hands, whether it is work, hobby, or sports related. Problems with your leg muscles stem from not being able to escape, flee, or run away, literally or figuratively, be it from a workplace or a relationship. Also not being able to leap aside, not being able to follow, feeling rooted to the spot, or petrified, feeling trapped, literally or figuratively, not being able to keep up, not being able to climb up, so for example not being promoted in your job, not being able to kick somebody away, as well as a fear of not being able to walk. Motor conflicts can also be experienced with or on behalf of someone else, mainly when feeling stuck concerns a loved one. The belief that conditions such as ALS and MS are hereditary makes a family member more susceptible to conflicts of the same kind. A fetus might also endure such a conflict of not being able to escape when the mother is in danger or because of threatening noises in the immediate environment, loud kitchen equipment for example, such as blenders that are held close to the womb, a lot of screaming and yelling when the parents are fighting, or when the mother or the father are yelling at the children. And in this case, the baby can be born with a partial paralysis of the legs and motor disabilities if the conflict is not resolved. Additionally, the loud noises of ultrasound examinations can also be traumatic for the unborn. A feeling stuck conflict is activated during a difficult delivery, or how it can also be caused by how the baby is handled immediately after birth. The motor disabilities seen in cerebral palsy, which according to conventional medicine is caused by brain damage that occurs to the developing brain, result from motor conflicts experienced by the fetus in the womb or during birth. The conflict active phase of such conflicts manifests with cell loss of muscle tissue and at the same time with muscle weakness or muscle paralysis. With the impact of the conflict in the motor cortex, fewer nerve impulses are transmitted to the corresponding muscle, causing a loss of muscle function thereby. And the biological purpose of this paralysis originates in the fake death reflex that we also see in animals, where some animals play dead when they face a predator or danger. Muscle weakness might be noticed first as clumsiness or heaviness when the legs are affected. Prolonged conflict activity leads to muscle atrophy, also known as muscle wasting, or in TCM as the weisyndrome, without paralysis if the conflict is experienced only as a self-devaluation conflict. For example, the pelvic floor muscles become weak because of a problematic pregnancy, sexual humiliation, chronic constipation, or urinary incontinence, making the person feel worthless. If a motor conflict occurs, the muscle atrophy and muscle paralysis manifest together, particularly when the distress of not being able to move an arm or leg, or both, causes a self-devaluation conflict. Muscle weakness and muscle paralysis were once upon a time diagnosed as paralytic poliomyelitis, or polio for short, that was purported as a viral infection that mainly affects children. The scientific evidence of the existence of the so-called poliovirus has never been provided. Today, in our Western world, where polio was supposedly suppressed and eradicated by vaccinations, the same symptoms are called ALS, or amyotrophic lateral sclerosis, also known as Lou Gehrig's or motor neuron disease, or multiple sclerosis, GBS, or Guillain-Barré syndrome. Movement disorders, as presented in Parkinson's disease and Huntington's disease, are considered to be genetically inherited, which in our point of view is not true. The brain CT that you see here at the bottom right shows the impact of motor conflict. The center of the focus is on the right brain, as you can see, on the right brain hemisphere, paracentral precisely, and in the area, that is the area of the motor cortex that controls the left leg. And a partly edematous ring, so the dark ring, indicates that the healing phase is interrupted by constant conflict relapses. That's why you see the sharp borders. Hence the continued weakness of the legs, in this case of the patient predominantly of the left leg. Whether the muscle atrophy or muscle paralysis occurs on the right or the left side of the body or both sides is determined by person-handedness and whether the conflict is mother-child or partner-related. Muscle weakness and a loss of sensitivity in the feet, legs or arms are considered to be one of the first symptoms of multiple sclerosis. The significant danger is that the patient suffers a motor conflict due to the diagnosis shock of multiple sclerosis, since he or she has just been told that he or she will most likely end up in a wheelchair for the rest of their life. Additionally, the MS diagnosis causes a great panic that affects at a later stage the kidneys and the lungs as well. And the same holds true for when a person is diagnosed with ALS. The fear of not being able to walk and ending up in a wheelchair, so feeling stuck, is so overwhelming that the motor conflict, which had given rise to the first symptoms, often becomes irrelevant. With the progression of the paralysis, the muscle atrophy also advances, leading to clumsiness, difficulties walking, and frequent falls. And this activates additional motor and self-devaluation conflicts, resulting in the mobility becoming more and more impaired and the prognosis becoming a self-fulfilling prophecy. The belief that MS, ALS or Parkinson's disease are hereditary diseases makes a person whose parent has the condition more vulnerable to suffering a motor conflict, because conflicts, as we've discussed, can also be experienced on behalf of someone else. And the following symptoms quickly lead to the same diagnosis, which makes it seem as a hereditary genetic condition. In conventional medicine, it is assumed that multiple sclerosis is caused by the degradation or degeneration of the so-called myelin sheath, as concluded from MRI brain images. What is this myelin sheath? It's an insulating layer that envelops the nerves, including the nerves in the brain and the spinal cord. Additionally, myelin destruction is thought to be an autoimmune response where the immune system mistakenly destroys the myelin sheath covering the motor neurons in the brain. However, like the immune system theory, the concept of autoimmune disorders that supposedly damage healthy body tissue is an academic construct with no scientific basis. And therefore, the claim that MS or any of these conditions results from the destruction of the myelin sheath is highly questionable. On the MRI, that you see here on the right, the suspected demyelination, called also multiple sclerosis plaque, shows up in the cerebral medulla, specifically in the area that controls the muscle's trophic function around the right hip. Neurologists consider the abnormal white area as the reason for the paralysis. Additionally, this so-called MS plaque is an accumulation of neuroglia, indicating that a person is trying to heal a self-evaluation conflict caused by motor paralysis. Note also that the myelin sheath is controlled from the cerebellum and linked to a touch conflict. If a buildup of neuroglia is found in the motor cortex, then this MS plaque is diagnosed as a brain tumor, usually followed by an excision of the lesion. Let's look a little deeper into the functions of this myelin sheath. It forms an insulating layer around the brain and spinal cord nerves, as mentioned, and each nerve cell or neuron consists of a cell body with a nucleus, so the DNA, and dendrites, so the nerve endings that project out from the cell body to receive signals from other neurons. The axon is an extension that differs from the dendrites insofar as it carries impulses away from neurons, sometimes over considerable distance. Longer axons are also covered with a myelin sheath, and the function of the myelin sheath is to speed up the electrical transmission along the nerve cells. The myelin sheath, enveloping motor neurons, aids in the conduction of nerve impulses to the muscles, and the sensory neurons communicate sensory stimuli such as touch. The myelinated neurons are therefore typically found in the peripheral nerves. Myelin originates from the so-called Schwann cells, which are specialized glial cells. Additionally, glial cells called neuroglia provide support and protection for neurons in the brain and the spinal cord. On the other hand, Schwann cells are found in the peripheral nervous system, so outside of the brain, forming the myelin sheath around nerve cells. In us humans, myelination begins in the 14th week of fetal development, and like the glia, myelin consists of mostly of connective tissue, and the myelin sheath derives therefore also from the new mesoderm. Even though the myelin sheath is of new mesodermal origin, it is controlled from the cerebellum and not from the cerebral medulla. The left side of the brain controls the myelin sheath on the right side of the body, and the right brain hemisphere controls the myelin sheath on the left side. So there is again a crossover relation from the brain to the body. Note also that the myelin sheath is controlled from the same brain relay as your corium skin. The biological conflict linked to problems with the myelin sheath is a touch conflict of not wanting to be touched because the touch is experienced as painful, unpleasant, or unwanted. Also the fear of being touched, be it by physical abuse or sexual abuse. And the myelin sheath also responds to a pain conflict triggered by acute pain due to an injury, for example, a fall or a hit. Severe pain, for example bone pain, can also activate this biological special program. During the conflict active phase, the myelin sheath thickens through cell proliferation, forming a neurofibroma beneath or on the skin. Like a melanoma, a neurofibroma is an archaic form of defense, and the intensity of the conflict determines the size of the nodules. The biological purpose of this cell increase is to block the peripheral sensory stimuli from being transmitted to the brain. the extra tissue absorbs the unwanted touch or pain. The symptoms are a loss or a decreased sensitivity to touch at the affected area. Even though myelin and neuroglia are related tissues, they behave very differently. A neurofibroma, also referred to as a peripheral glioma, grows during the conflict active phase. And in contrast, neuroglia, for example brain tumors, proliferates in the healing phase. The appearance of the neurofibroma under the skin is like that of a lipoma involving. A person's handedness determines whether the right side of the, or the left side of the body is affected and whether the conflict is mother-child or partner-related. Localized conflict affects the body parts associated with the touch conflict. Multiple neurofibromas beneath or on the skin, also known as cutaneous neurofibroma, are termed neurofibromatosis type 1 or Recklinghausen disease. Café au lait pigmentations or coffee-colored patches on the skin are classified as symptoms of this neurofibromatosis type 1 and are related to the epidermis rather than the nerve sheath. The fact that these café au lait spots are observed in many people with NF1 indicates that the two biological programs, so separation and touch conflict, run concurrently. Bell's palsy with paralysis or weakness of the muscles on one side of the face occurs in the conflict active phase of a so-called loss of phase conflict. It can also be caused, of course, by strokes and other issues. And facial twitching or facial tics typically occur during the healing phase. The facial muscles are supplied by the facial nerve, also known as the seventh cranial nerve, that also innervates the front 2/3 of the tongue, the upper eyelid muscle, the tear ducts, and the stapedius muscles of the muscle of the ear. And symptoms of Bell's palsy include tongue weakness, affecting speech and swallowing, tingling or numbness of the tongue, and a loss of taste originating from the facial nerve's sensory branch, incomplete lid closure, excessive tearing, and heightened sensitivity to sound. Facial paralysis can also occur when a brain edema close to the control center of the facial muscles is expelled during the healing phase. For example, significant swelling in the brain relay of the inner ear. Whether the facial paralysis is caused by biological conflict or the result of a brain edema located close to the brain relay of the facial muscles can be easily determined through a brain CT. During the healing phase, the atrophied muscle is reconstructed through cell proliferation with swelling due to the edema. Additionally, concurrent water retention due to the kidney tubular syndrome increases the node considerably. In conventional medicine, the significant bump is often diagnosed as a so-called muscle sarcoma or soft tissue sarcoma. Muscle hypertrophy is the result of a continuously activated healing process, a so-called hanging healing. And all organs that derive from the new mesoderm, including the skeletal muscles, show the biological purpose at the end of the healing phase. And therefore, after the healing process has been completed, the organ or tissue is more vital than before, which allows for being better prepared for conflict of the same kind in the future. The swelling makes the muscle stiff and tense, with pain ranging from mild to severe, depending on the intensity of the conflict active phase. A cold muscle pain points to an involvement of the periosteum, and a hot muscle pain indicates that the muscle itself is healing. person's handedness determines which side is affected and whether the competition or the conflict is mother-child or partner-related. Fibromyalgia is the medical term for widespread muscle pain, and with inflammation the condition is called polymyalgia or polymyalgia rheumatica. Fibromyalgia and polymyalgia indicate a long-lasting healing of a generalized self-devaluation conflict that affects that person. In conventional medicine, widespread muscle pain is also considered a symptom of chronic fatigue syndrome, as well as myalgic encephalomyelitis. The persistent tiredness is believed to be caused by an infection with the Epstein-Barr virus, which has also been made responsible for mononucleosis presenting as swollen lymph nodes in the neck. However, chronic fatigue is a symptom that occurs in any prolonged healing phase. The swelling of a healing bone or joint might cause pain in the overlying muscle tissue, and the brain edema that develops in the motor cortex during the first part of the healing phase stretches the synapses between the neurons, which delays the transfer of nerve impulses to the affected muscles even more. As a result, in the first part of the healing phase, the paralysis remains and the muscle weakness increases. For the uninformed person, further loss of muscle function usually leads to other motor conflicts and can worsen the condition even further. However, if the conflict active phase was moderate, muscle weakness might only be noticed in the healing phase. On the brain scan, here on the right, we see edema, so a fluid accumulation on each side of the motor cortex in the areas that control the right and left hand, revealing that conflict of not being able to hold someone or not being able to defend oneself with both hands has finally been resolved. Unfortunately, at this point, the hand muscles are still weak. This, however, changes eventually in the second part of the healing phase. As touched upon in the beginning of this presentation, quickly, in Eastern medicine, muscle atrophy and muscle weakness are known as weisyndrome. Weisyndrome refers thus to a group of disorders with symptoms ranging from flaccidity and weakness in the sinews and muscles to diminished muscle mass. Muscular atrophy may be localized or systemic. The lower extremities are often more affected, resulting in weakness and difficulty ambulating, and as their capacity for voluntary movement diminishes, unremitting weisyndrome progresses to a total loss of mobility of the knees, hips, shoulders, arms, or spine. Weisyndrome affects the muscle's trophic function and is caused, as we have discussed, by a self-devaluation conflict. Note that the weisyndrome appears in the general symptomatic picture of specific deficiencies such as Qi, Yin, Yang, and Jing, affecting different organs such as the lungs, spleen, stomach, and kidneys. And therefore, the successful treatment of this weisyndrome is at the same time a therapy for the problems with the other organs that are affected. When it comes to symptoms, in Western medicine, weisyndrome is associated with sequelae of encephalitis, spinal cord trauma, muscular atrophy due to polio, multiple sclerosis, and tumors in the central nervous system. Additionally, it shows up in many diseases such as muscular atrophy, muscular dystrophies, myotonic syndromes, periodic paralysis, myasthenia gravis, endocrine myopathies, hysterical paralysis, etc., etc. Western medicine, as mentioned also at the beginning of this presentation, has no specific cure for most types of weisyndrome, but TCM does, and we are going to discuss those. But before we do that, a short classification. In TCM, we divide this weight syndrome into different categories. One is muscle flaccidity syndrome that involves the spleen. The other one is bone flaccidity syndrome that involves the kidney. Tendon flaccidity syndrome involves the liver. Vascular flaccidity syndrome involves the heart. Skin flaccidity syndrome, which involves your lungs. Tongue atrophy due to radiation, for example, as well as traumas. Let's look then at natural solutions to resolve all the possible causes of these Weiss syndromes, starting with lung toxicity. When the lung is invaded by an exterior pathogenic toxicity or heat, it exhausts the body fluids and the lobes of the lungs become atrophied. When the heat lingers chronically, paralysis of the extremities occurs. External pathogenic heat invades the lung. Excessive internal heat can also invade the lung, or extreme internal heat can accumulate. And this can damage the lung's yin and the body fluids, resulting in malnourishment of the muscles and tendons, which may develop into strength atrophy of the limbs. When it comes to symptoms, weakness of the four limbs after fever is one, as well as restlessness, thirst, coughing without sputum, a dry throat, scanty and yellow urine, constipation, a red tongue with a yellow coating, and a thready and rapid pulse. Weiss syndrome due to lung heat with fluid deficiency manifests with perverse dryness, heat attacking the lungs, general qi, and yin deficiency. So symptoms here are dry, hacking, coughing with little or no sputum, a flushed face. The sputum is also difficult to expectorate. Restlessness, maybe hemoptysis, hiccups, coughing with chest pain, dyspnea, dry or sore throat, upper respiratory tract infections, a hoarse voice, asthma, dry lips and mouth, fever, shortness of breath, hemoptysis, decreased urination, constipation, thirst, dry skin and hair, dryness in the nose, the sensation of fullness in the chest, epistaxis, hypochondriac pain, chills and fever, headaches, anhidrosis, irritability, and skin itching. And a natural formula that we can use to resolve these problems is an Aereo-Botrytis and Ophiopognon decoction and or a Glienia and Ophiopognon decoction. And as you can see, these decoctions can also be used for a whole range of other problems such as pertussis, asthma, upper respiratory tract infections, pulmonary tuberculosis, influenza, chronic sore throat, emphysemas, headaches, etc., etc. Another possible cause is damp heat. Obstruction and lesion of the channels and tendons due to accumulation of damp heat caused by living in wet areas, eating fat, hot and spicy food a lot, or drinking too much alcohol. Symptoms here are heaviness, tightness, weakness of the four limbs or edema, numbness, especially in the lower part of the body, or fever, oppression and fullness of the chest, hot or painful sensation when urinating, a yellow greasy tongue coating, as well as a thready, deep and rapid pulse. And here, to get rid of the damp heat, we want to clear it and eliminate the dampness to open up the circulation of the channels and tendons, and we can achieve this with a Coix combination, Tang Kui and Anemarina combination, which are also good for a whole list of other conditions such as generalized body aches and pains, irritability, discomfort, redness, itching of the skin, persistent swelling, chest pain, fever, thirst, etc., etc. If the weisyndrome is caused by spleen and stomach deficiency, the symptoms are weakness of 4 limbs, progressive muscular atrophy, poor appetite, pale or swollen face, and fatigue. Also loose stools or watery diarrhea, weak extremities, weight loss, distension and stifling sensation in the chest and epigastrium, a pale, wan complexion, abdominal distension, indigestion, vomiting, fatigue, chills, maybe also leukorrhea, reduced appetite, borborygmus, edemas, diarrhea with the onset of menstrual flow, coughing with copious sputum, and leukorrhea in obese women. And the formula that we can use to resolve this problem is ginseng, poria, and atractalodes combination that strongly tonifies the spleen and lung qi, and also strengthens the muscles through blood nourishment. And this formula can also be used for a whole range of other conditions, as you can see, ranging from gastritis, hepatitis, to bronchitis, nephritis, and many, many more. The neuromuscular disorder can also be caused by liver and kidney deficiency. Symptoms here are because the liver stores the blood and also the life essence, the blood and essence which supply and nourish all the tissue, blood and essence that supply and nourish everything, including the muscles and tendons, of course. Prolonged problems with the kidneys and liver or indulgent sexual activities can cause excessive loss of blood and kidney essence, also known as jink, which results in an inability to nourish the tendons, muscles, bones, and different channels. And typically, the symptoms are muscular flaccidity of the limbs, mild to moderate amount of motor weakness, stiffness in the legs with reduced mobility and soreness, a weakness of the knees and hips, impotence or uncontrolled seminal emission, a light red tongue with less firm, a thready and rapid pulse, sore and weakness in the lumbar regions, dizziness, tinnitus, and enuresis. And the formula that we can use to resolve this is a Romania 8 decoction or a Romania 6 formula that tonifies the kidney yang and yin. And these formulas can also be used, as you can see, for a wide range of other conditions. So, as you can see, there are many possible causes for your neuromuscular conditions such as MS or ALS. Therefore, a proper treatment starts with the right diagnosis. We can do this for you remotely. Contact us at christine.doctor and we will go from there and develop a customized, natural, holistic approach to resolve it. The causes, as we've discussed, they can be psychosomatic or physical. This has to be established. Often it is a combination of many factors. And the good news is these conditions can be successfully addressed. So, with all that being said, I hope that you've enjoyed this presentation. If you did so, please support us directly by becoming a patron from as little as $5 per month. Link is in the description box below. Also, do not forget to like, share, subscribe if you're not already, and comment to help this channel grow and spread the truth. As mentioned, for the holistic care you need and deserve, please contact us at christine.doctor and also check out some of the most powerful holistic health tools available on the market today at vibrantbody.net. Some of them can also help you with your neuromuscular disorders. Links are, of course, as always, also provided in the description box below. Thank you very much for your attention, and until next time, stay healthy.